Today's session is entitled Leveraging Texas State University's Resources to Improve Mental Health. We know that many of you are already involved in mental health space in the Central Texas area, and you might know a lot of the information that we are talking about. With that said, we hope that today can give you some talking points in regards to conversation starters or new perspectives that you might have, and again, help us build something that is really worthwhile, and to kind of help connect some dots that we might have not seen that are out there. Today we are joined by Dr. Melinda Villagran. She is the Executive Director of the Translational Health Research Center, and over the past 5 years at the helm of the Translational Health Research Center, we have connected with hundreds of organizations, worked with countless faculty members, and received millions of dollars in funding. Today, she will discuss the centralstate.com, which is an initiative we are working on, and we want to share with you how it can continue to be an impactful resource for our community and Central Texas mental health as a whole. So without further ado, Melinda Villagran.
Great. Thank you so much, Cody. I'm excited today to talk with you about a project that came about during COVID. Originally, because at that time, many of us, really using the dashboards that were created to help us understand what was happening around us in terms of COVID and the spread of COVID in our area. So this is a really short talk to kind of introduce you to one of the many projects that we have at the Translational Health Research Center. And this particular one is called the Central State. So this project has direct relevance to a few things that are happening in our area that I'm going to talk about with you and kind of introduce you to the Central State. And then when I'm done, we're going to have someone that can really walk us through and navigate with the details of this platform so that you can get better oriented with it and hopefully become our partner in using it and in creating it. So before I talk about the Central State, I just briefly want to introduce you to what has been my passion for the last 9 years, which is the Translational Health Research Center. Texas State had a really unique opportunity as we developed our research programs and became what is just about to be a Research One institution, because we had kind of a clean slate and we knew we wanted to do things slightly differently. And so our research is very applied, meaning not only do we discover things and pursue new knowledge, but we also try to ensure that new knowledge reaches the people who can actually benefit from it. And this is baked into our process. And so to make that happen, we needed an infrastructure that could help support a broad range of research topics in a broad range of disciplines. And it could also help us leverage relationships, not only among people within our university, but between our university and others in our community, so that we can make sure that we're asking the right questions in our research and make sure that we have processes that make sense to get information to people who need it. So the Translational Health Research Center started as an initiative, and we are in our 5th year as an official university level center, looking at all kinds of health and resilience issues across 5 major areas that you see below. And so the Translational Health Research Center is built with the idea that we will, as an institution, develop research that has relevance to improve health and resilience in Texas. And we have multiple funding sources and grants that come and go, but what is the same across everything that we do is our commitment to partnerships with community organizations, and in this case, with mental health organizations across the region. So as I mentioned, THRC is really focused on this idea of innovation through collaboration. And I wanted to kind of talk about how we do that, just because it makes the Central State a lot easier to understand. So our projects, our programs, and partnerships seek to foster this collaborative spirit that helps us do applied research. Our projects are one and done, standalone things that we do, often tied to a grant or funding source, where it has a beginning and a middle and an end. But what's unique about the projects that we do is that we've built relationships on campus to know not only who are the people here who can bring expertise and resources to make these projects successful, but also who are the best people to collaborate with, who have research that has real meaning and potential to improve lives and to do things that matter in partnership with community organizations, government, businesses, and other entities that we work with. We work with other universities quite often, as you know, most universities do, but we work with business and industry, government, nonprofits, and individuals also. And we value all of those relationships. And when we have a group of projects, they typically become a program, meaning something that has a little bit longer shelf life. And that is the Central State. It started as a project, but it is now a program that will only be successful if we have the projects and partnerships that we need to breathe life into it and then sustain life. Anybody's ever built a website can definitely probably identify with the idea that you feel like it's a labor of love while you're building it, but it's only really a good website or a good platform or a good piece of software if people actually use it. And then that's kind of when the magic happens, that there becomes this energy that is facilitated because it's really just a tool. And the Central State is just a tool. We created it with the idea that it could be sort of a town square for mental health and mental health care resources and information and news and data. And that was needed in our area because our area is changing. So as I got a ton of meetings in my job and all up and down the corridor and everything from chambers of commerce to healthcare to government to, bio and life sciences across the board. And when I go to San Antonio, I often hear people talk about this merger between the San Antonio Metro Service Area and the Austin Metro Service Area that is happening as we speak over time because we're all growing. But when I'm in San Antonio, they call it the future San Antonio Austin MSA. And then when I go to Austin, I often hear people talk about this growing region, and I hear about this future Austin San Antonio MSA. So I'm not sure what it's called. I just call it the megaplex. And I think that there are some estimates that by 2030, Austin and San Antonio could potentially be one united metro service area. Now, why does this matter to mental health? Well, I think place matters. I think we can all agree that the social determinants of health are hugely important for not only the way people experience mental health, but their opportunities to get help when they need it, and for us to understand the need and then provide services that align with those needs. So if we have gaps, you have to ask yourself, who's the we? And I think the we is changing. So we collectively have to do a better job of understanding who are our clients, what is the need, what are the issues, not only in my front porch, out my front door, or not only in Austin, not only in San Antonio. If you look at this population chart, I highlighted for you what I call the middle, the middle of the corridor. That's not Austin, that's not San Antonio. And anyone who's tried to drive into Austin or San Antonio knows that it can be challenging to access care. So if everything is located in our major metropolitan areas, it is in some ways inaccessible to people who aren't in those areas. But we also know that people don't live where they work. We have a lot of commuters. Increasingly, especially with return to work, we have found that people are driving up and down I-35 corridor. So you may prefer to access care near your workplace, or you may prefer to access care near your home. And although we are merging, those two things are very, very different. And if you look at places like Kyle and New Braunfels, Buda and Round Rock, you see this really diverse and growing community of people who have potentially very, very similar mental health care needs as what we've been doing for many, many years. But there's also a good chance that there are new issues. that there are changing dynamics and demographics that make it really important for us to kind of like step back and go, what's going on here? If we really want to be responsible and be responsive to the needs of the people who live and work along this corridor. So in general, the Central State was built with the idea that we, the Central State, meaning in this case defined as the corridor from Austin, Round Rock, MSA, to the San Antonio, New Braunfels, MSA. We need to understand ourselves collectively and not separately, because it's just a fact. I did a project a long time ago for City of Austin, and I was shocked at the number of people that drive from south of San Antonio to go to work in downtown Austin every single day. When you're talking about infectious disease, that has obvious implications. But when you're talking about mental health, it does too, because it's really tough to run home to a visit or go to, to an appointment in San Antonio near your house if you're working in Austin. It's just not feasible. So this area, when I say we, I mean all of us in the Central State, everybody that lives from Austin MSA to San Antonio MSA, we have to do a better job of understanding ourselves to be able to address mental health care needs and services that matter to the people. As the population is changing, the community is changing, and the need is changing. And so we built the Central State as sort of a town square, sort of a front porch, where people could go and get information, because places are often defined by data. So you need access to reliable data. And then all these organizations that are doing amazing work to help their clients and to provide services and resources that are relevant to improve mental health, they often struggle to publicize things that they're doing, or things that they're doing well, or things that they could share as best practices. And so we wanted to have a place for you as organizations or as community members to share as well, so that if you have things like events or news stories or issues, that you could write a blog post or share some data or find some data, to write a grant or partner with THRC to figure out where is the best funding source for this gap that I've identified in my area, and I'd like to expand my services. And I just thought that was all way too hard when you're just overrun with so many clients that have so much need. It's just not reasonable to think that you're going to keep up on all of these trends. So that's what the Central State is built to do. But it will only be successful, again, kind of like any other piece of software, website, hub, whatever platform, if we use it. And we are going to host it. It is a program that we are committed to sustaining as an organization. But it's not going to be good if it's not populated by the people that know what's happening on the ground, and that's you. So today we wanted to present it to you and kind of encourage any of you that want to use it as a resource for sharing, and use it as a resource for collecting information if you're going to write a grant or you want to understand something. So we have staff that are going to keep our end current, but it's a shell right now. I have the build it and they will come mentality. I built my center with the idea that it would grow, and it has grown and grown and grown to be a really large and successful university level research center that's focused on applied health and resilience. But the Central State is in its infancy, and I'm hoping it will grow in the very same way by the partnerships and the programs and the data and the news and the help that it provides to improve mental health in our area. So these are some of the things that the Central State can do. As I've talked about, county health data, mental health services mapping, so place-based service locators, training. We have some virtual training opportunities. We've already developed 2 specific training opportunities, but we could create more, or we could share ones that you have. Funding opportunities. We want to make available places where you can get the resources that you need to do new things or different things that are not currently in your budget. And then news and events, just knowing what's happening across the corridor in the Central State, that will help us become a collective. So we're not just Austin or not just San Antonio, because it's just, as I said, not realistic to think that you're really serving the people in your area if you're only looking at the people who live in your area or work in your area, because that is a very, very dynamic and changing thing in our region. So I want us to think hopefully about the Central State mental health care needs as one thing. And we want to think of a we who can work together through this platform to try to do things that are innovative and helpful and that really elevate the opportunity for mental health care services in our area. So I want to turn it back to Emily, Cody, Shelby, somebody on my team who, by the way, I cannot tell you how grateful we all are to have this team working on this project because they're doing a fantastic job. And I am literally just at their mercy and say, tell me what to do. And it all works out because this project is something that they are all very invested in. And Marcia, Bernie, Emily, Shelby, Cody, all of them have done a terrific job. And I believe truly that if you will give them a chance and share information with them and seek information with them and partner with us, that they will be a good resource for you.
Melinda, appreciate that. For some extra context, we added the Central State, or Shelby added the Central State website to, I guess, to the chat. So if you want to take a look at it and kind of walk along as we go through it, that'd be amazing. And I saw that a couple of questions are rolling in. We're going to answer those in the open discussion after we do a little bit of a case presentation, if you will. So I'm going to pass it to Marcia and Emily to have them walk us through the Central State and to give us more of a visual representation of kind of what we're talking about here.
All right, everyone. So we're going to get started with kind of a demonstration, like Cody said, of the Central State. Again, we encourage you all to explore this on your own time. Maybe check to see if what your organization has going on is up on the Central State, and if it isn't, reach out because that's what it's here for. But to get us started, this is the home screen. So like if you click on the link I just put in the chat, this is where you're going to go. If you scroll down, you have some of the areas that the Central State is focused on. And then if you keep going down, and we're going to go into detail into all of these as well as we go through this. But I also want to pass it over to Marcia really quick to talk about some of these trainings that you find on on the very first page of the Central State.
Hello, everyone. Yes, I did want to talk about visualizing mental health and mapping public health. The first thing that I want to say about these is that these are trainings that we have available to you all, the public, for free. It's a no cost. These are asynchronous trainings that you can do online. And when we talk about visualizing mental health is the main one that I wanted to speak to you all about right now, we are talking about telling the story. So we do talk about data, we talk about the numbers and data, but actually looking at it in a storyboard and being able to visualize what that looks like sometimes hits home a little bit more to folks when you're going out and kind of talking about your organization or talking about the community in which you serve and you're seeing gaps or you're seeing a lot of something in one area. And so Bria Black, I know that you're on this call. I don't mean to call you out here, but I know that we connected on one of the echoes and you came over here to Hunter and you saw a few story maps out on the table and you got really excited about looking at them. And so I said, well, this is a perfect segue to talk about visualizing mental health and what this could look like for you and your organization or your website that you have just launched. Congratulations again for that. And Sitlali Escatel is someone who is working with us very closely. She's a member of our team who is working with visualizing mental health as well as mapping public health. And so as we're looking at this, again, we're telling the stories about mental health. We're also telling the stories about public health, and we are mapping those on a storyboard to be able to get that information out to the public for various things and various needs. Melinda, is there anything that you wanted to add to that part?
Just that both of these were created with the user in mind. And so, we have created the training to help you map your story, your organization, and understand a little bit more about what's happening over time and space in place-based issues related to mental health. That's mapping. And then visualizing is that really important piece about no one likes data. They like data visualizations, right? I mean, data is only as good as the story that it tells, and stories are better when they have pictures. So visualizing mental health just is a way to, create information that's usable for any kind of presentation or grant or anything that you do, because it's going to be easily digestible if you can visualize it in ways that make sense. But you have to be able to track it too. So it's the dashboard along with the visualization tools.
Yes,
Awesome.
thank
Okay.
you. One more thing to
Yeah.
add, Shelby, I'm sorry. You
Yeah.
don't need any prior training for either of these trainings that are online. This is something that you will be walked through each module that you will find. So I did want to add that part to this. So thank you.
Awesome. Thank you, Marcia.
Mhm.
So yes, this is our homepage. And then if you scroll back up, tools and resources, this is a big one that we develop every month, making sure all the data or everything on there is up to date. Funding opportunities is important, and I'm going to pass it over to Emily to talk a little bit about this.
Okay. Hi, I'm Emily. So here on the funding opportunities page is where we share funding and grant opportunities specifically with the aim of helping organizations develop or expand health-related programs in Central Texas. So if you scroll down, the opportunities closest to the top of the page are those whose deadline is approaching soonest. And as you scroll further down, you will see more funding opportunities that have rolling deadlines and opportunities that are also open annually. If you click on the description tab, a short blurb about the grant opportunity is available, as well as a direct link to the sponsor's website where you can get more detailed information about the grant's requirements.
Awesome. Thank you, Emily. So yes, those are our funding opportunities, and that was when you looked at right here under tools and resources, and then you can also look at local organizations. You can do that by county or by map view. For today, we're just going to look at by county. So for example, you come here, what county are you in? What county are you interested in? Maybe you have a patient or a client you're seeing that's in that county, and you want to refer them to an organization that's local. So you can go check it out. You can look and kind of see what's going on in that county. Again, if your organization is in that county and you see that you're not on this page, please let us know. And yeah, so that's just a little example of that. And then we're going to go back to the next tab, see how we compare. And that's going to be kind of how your county is situated with your neighbors. And we're going to, for example, go to Caldwell, and then I'm going to pass that over to Marcia to tell us a little bit about this. Oh, and you're muted, Marcia.
Of course I am. Thank you. You're very quick on that. I wanted to talk about this feature, see how we compare. Lindsay Kosin, first of all, I thank you for coming to all of our ECHO sessions, but she had a great question that, oh, I see all of the cities that you're talking about, but what about rural communities? And this is an example that I'm going to provide for a rural community for exactly what you are talking about when we're seeking funding and seeking support from maybe some other outside funders. And so when we're looking at see how we compare, we are looking at the 7 counties of Bastrop, Bear, Caldwell, Comal, Hayes, Travis, and Williamson counties. It's that I-35 corridor. And what you'll notice about these, see how we compare, is that these counties touch each other, but there's a difference in quite a few of them. They have different needs and they have different things that they're requiring. And so, for example, most of these counties, except for one, rank in the highest of the healthiest population, so 75% to 100%. The one county that falls in between the 50 to 75% range is Caldwell County. And so what we're talking about here about comparing things are health indicators. So health indicators are a lot of different things, health behaviors, the access to clinical care, your economic factors that are there, environmental factors even. And so that's just a few of the things that are in this page that we're looking into. And so what this does is this impacts the health outcome. So your quality of life, excuse me, as well as your length of life. And so when we look at Caldwell, one of the places that based off of this and based off of some of the data we're seeing, we're doing a road show. And so when I say road show, we are going on the road to talk about the Central State. I apologize, y'all. I see Norma on this call. I see Marisol on this call, and we have met you all at different conferences and different events that we're going to. And so I think it's great that you all are able to come to these echoes, but we're going and we're talking to people and we're listening to what their needs are. And so a few weekends ago, I did go to Martindale. I went there. It's a rural community. It's a place that THRC has identified as a place that we want to learn more about. We want to get to know, where do people go to get their health information and to disseminate information when they're having health crises, when they're wanting to be preventative in health, and all of those other things. And so when we're talking about Martindale being ranked 109 out of 244 counties, but all the other counties that we're looking at rank between 3 to 51 out of 244, we have to not just look at numbers, we have to talk to the people. We have to hear their stories. We have to, again, put those numbers on a storyboard, but we also need to tell the narratives that we're hearing, and we need to, most importantly, what Melinda was talking about, use this website and other means that we have to highlight that organization and highlight that community, because we can't speak for everybody, but there are rooms that we're in that they're not in, that we can, say some of the things that they're looking for and ways to support them. And so this kind of helps you to kind of look and see those gaps that Melinda was talking about, but also look to see what things are going well in communities, and maybe some ways to continue that preventative care and preventative access. So I think my 2 minutes probably are up, but I wanted to make sure that I that I talked about that.
Oh, that's perfect, Marcia. Thank you. And then going back up to the top as we continue our exploration, we have events and news. We're going to go to events really quick. And Emily, can you tell us a little bit about this tab?
Yes. So our events page is where we share upcoming health and wellness events and activities in Central Texas. These events are mostly free and open to the community. If you scroll down the page, you'll see we have a calendar view there on the left that specifically highlights one-time events, both in person and virtual, with direct links to the events webpage. On the right-hand side of the page, we have a list of events that are recurring, so monthly, weekly, bi-weekly, etc., along with information and links to learn more. These recurring events include both in-person and virtual support groups, as well as webinar series. And then at the bottom of the page, you will find all of our events are organized into 4 categories. So virtual support groups, in-person support groups, webinars, and then community and special events. So you can find exactly what you're looking for. As Melinda was sharing earlier, we encourage anyone who has an event they would like to share with the Central State, or a funding opportunity even, and as we go on to news, to please email us at healthresearch@txstate.edu, which is at the bottom of our page. You can contact us there, but we would love to share your event and highlight it here on the Central State.
Great. Thank you, Emily. And last but not least, we have our About section of the Central State, and that's just kind of consolidating a lot of the things that Dr. Villagran just went over in her presentation, sort of talking about the reason it exists and its existence now. And then again, at the bottom, we have our healthresearch@texasstate.edu email. And we also have a survey this is on Qualtrics to tell us how we can maybe improve the Central State if you're using it and you notice something that you would like to see different. Again, please reach out to the email to add your organization, your event, your group, anything like that. Also, if you're getting emails from Echo Texas State and you just want to send an email to Echo Texas State, I can make sure it gets into the right hands as well. And then also, yes, Melinda.
Really, before you leave that, this is very important. We need feedback, because we would like for the number of staff members that we need to build this to decrease as others find it to be a resource to share what they're doing. And we are non-discriminatory in our sharing. We want to share. I saw a really cool thing, getsupporttogether.com, in the chat. Love this. We want to populate this with a lot of things. And if this ever becomes obsolete, that would be fantastic. But that would mean that we've really penetrated the opportunities and the needs to share information in a way that really connects us as a region. So right now, the Central State has a role to play, and please tell us how we can improve. Use that survey that is at the bottom of the central